You're watching Fox 45 Morning News. All local, all morning.
Thank you, Lauren. Coming up, some are calling it an attack on women's health. Why new guidelines are now recommending that women get fewer pap smears. New guidelines about pap smear tests are raising a lot of questions for women. It used to be an annual test that screens women for cervical cancer. Well, now new studies by several groups, including the American Cancer Society, say the test only needs to be administered every 3 years. Dr. Amanda Fader from Greater Baltimore Medical Center joins us with a look at the new recommendations and what this means for women. Good morning.
Good morning, Patrice.
So is this something that we need to be concerned about? I mean, it's just a shock to hear because you're used to doing it annually.
Absolutely. Well, I first want to emphasize that the pap smear is probably the single most effective and successful cancer screening test in history. And before we introduced pap smear screening in the 1940s, cervical cancer was one of the leading causes of death in this country for women. But after the introduction of the pap, cervical cancer rates decreased by 70% and cancer deaths by 90%. That being said, it turns out that the frequency with which we've been screening women every 1 to 2 years may be completely unnecessary. And these new guidelines by 4 leading medical organizations suggest that in healthy women who've never had an abnormal pap smear or haven't had an abnormal pap recently may safely consider undergoing pap tests every 3 to 5 years.
There's not a concern that you can develop that cervical cancer, year to year and then it, go untreated or undiagnosed?
It's an excellent question. Many screening tests we use in medicine are not necessarily performed annually, including many cancer screening tests. Take the colonoscopy, for example. We perform that every 5 to 10 years because we know that the natural history of colon cancer is that it's a very slow-growing process. It takes years to develop. Okay. We're finding that cervical cancer belongs in that same category, and after years and years of clinical trials and studies, that cervical cancer can actually take up to 7 to 15 years to develop once you're exposed to the human papillomavirus, or HPV, which is the leading cause of the cancer.
Most women go yearly for this exam, and that's usually the only reason they go to see their gynecologist. Does that mean we don't have to go for yearly checkups now, or are there other reasons we should still make that yearly visit?
Absolutely. That yearly visit is still very important for breast screening and for pelvic examination and general women's health. And so I want to reassure women that even though their pap smear may not be scraped every year with the pap spatula, that your gynecologist or provider is going to still be performing a general women's health exam. They'll still be visualizing and examining your cervix and all your female organs to ensure that you're healthy.
A lot of women are wondering what's going on with women's health issues. I mean, they seem to be under attack in some ways. People are saying, well, we used to do mammograms more often. Now we don't do that. Now we don't do pap smears as often as we should. And they feel like women's issues may be going by the wayside.
Actually, this is a very good thing for women's health in many ways. And these are organizations that have always been huge proponents of advancing women's care. And the reason why this is a good step forward, it's twofold. The first is that actually performing tests too frequently may actually be riskier and not as safe for women than performing them every 3 to 5 years. The reason for that is because it increases the risk of false positive tests or having an abnormal test when nothing's actually wrong with you. And those false positive tests that can occur every year can lead to unnecessary biopsies, procedures, and those inherent risks associated with that.
It'll just be something we have to get used to.
Absolutely.
Dr. Fader, thank you so much.
Thank you.
Well, that brings us to our question of the day. What do you think about these new pap test guidelines? We're going to take your calls about that in our 7 o'clock hour. You can also go to foxbaltimore.com, tell us what you think, or sound off through Facebook. You can also send us a tweet at Fox Baltimore. Coming up in our hometown hotspot.